The Philippine College of Physicians warns that the ICU beds in Metro Manila are getting full yet again. But the health department says that the ICU bed utilization in the capital is now at low-risk category. Let's make more sense of these numbers with Private Hospitals Association or PHAPI President Dr. Jose de Grano, who joins us now live via Zoom. Good afternoon, Dr. de Grano. First off, I want to know what your latest data says about ICU bed occupancy, at least for private hospitals. How's it going?
Yes, I know that actually the COVID cases in the NCR area has gone down, and they are saying that some of the ICU beds are still full. But when we ask some of the big hospitals, they are saying that they are full, but mostly for non-COVID cases.
All right, so what do you think, Doc, caused the supposed discrepancy? I guess these are discrepancies in the figures on hospitalization rate. Do you think there's a delay that figures in somewhere here in reporting?
Well, probably that's one cause, but if you note, there is really a decrease in the number of cases in the NCR area. But of course, in other areas, in other regions, there is an upsurge already.
That's right. So I'm going to ask you that next. How serious is the situation of our COVID hospitals right now, especially those in hotspots outside Metro Manila? And what should the government be doing about this that they haven't already done?
Actually, it's a little bit serious in there because there are a lot of regions that are being affected. Northern Luzon, even Region 4. Now it's even Region 5. The Albay and Sorsogon are affected. And then the Visayas region, Northern, Mindanao, even Davao are affected. Even Cotabato have a surge of cases. So I think what the government should do is, of course, send some augmentation forces, and then probably in Mindanao and Visayas areas, and of course equipment if they are still needed. But you know, the facilities in these regions are only a few, and probably they can establish more isolation areas or isolation facilities in these regions.
Right, so can we then categorically say, Dr. de Grano, that the variants indeed caused more and severe critical cases, which of course lead to longer hospitalization periods for at least some patients? Or if not, what other factors come in play here?
I think the most important factor here is probably the complacency of the people, no? Because if you will know, these regions came from MGCQ, or a very relaxed quarantine areas. And so that may have contributed a lot in the spread of the infection. And then another thing is, of course, non-observance, of course, non-observance of the people. And then, of course, what we should do is to look into the variants, of course, because they have very high transmissibility rates. And you know, the people should also and local government units should be good in implementing the minimum health standards in these areas.
Right. So thank you for weighing in on that, Dr. de Grano. Now, I wanted to get your reaction to treatment czar Leopoldo de Vega's statement that people can actually now ditch face shields outdoors, of course, under certain conditions, like when the face shields are getting in the way of workers' safety or posing a danger to some commuters from the moisture that forms in front. What are your thoughts on this?
Well, probably in some jobs that require that you have a better view of what you're doing. But then I think that the most important thing here is these face shields. The face shields still contribute a lot in the prevention of the spread of disease. This will have additional protection for the person who is wearing it. It's not only in the hospitals that you should wear the face shields, but even outside. But of course, if it will interfere in the work that you are doing, then of course you can probably take it off whenever you are working temporarily.
All right. Thank you so much for all your insights, Dr. De Grano. That was Dr. Jose De Grano, the president of the Private Hospitals Association of the Philippines, joining us via Zoom. Thanks, Doc.
Thank you, Sean.